Across the country, hackers are launching cyber attacks against medical facilities. This week, a cyber attack hit Prospect Medical Holdings, a company with hospitals and clinics in multiple states. It disrupted computer systems, forcing emergency rooms to shut down and ambulances to be diverted. It's part of a growing trend. The FBI says the average cost of a healthcare data breach reached nearly $11 million in 2023, a more than 50% increase since 2020. Tonight, we sit down with cybersecurity expert Sai Huda to discuss the growing issue of cyber attacks against hospitals. Sai, thank you so much for joining us.
Thanks for having me.
So I guess my first question is, what do you think is driving the increase of these cyber attacks against hospitals?
Unfortunately, it's money. These gangs know that hospitals across the U.S. have not invested in cybersecurity, and they can easily reach them from thousands of miles away. And they can steal data and then extort a ransom payment. So that's really what they're after primarily. It's a money game.
Yeah, and if they're stealing data, what kind of data are these hackers taking, and do people need to be concerned?
Very much so. The data is very valuable because hospital has not only general information about the patient, social security numbers, but they're very personal, confidential medical records. Medical history, medicine that they take, diseases, whole host of things that are just so private. And so they can steal that data, which they're doing. They're putting in ransomware, which then unlocks, everything unless you pay them. But it's going to encrypt everything, and they're going to say, "Hey, pay us money. Otherwise, we're going to leak the data, embarrass you, cause you lawsuits." But the other thing is that they can take that data and they can sell it to other gangs in the dark web. So it's a double benefit for these attackers, unfortunately.
Yeah, absolutely. And we spoke to you earlier this year after some of our local schools were being targeted in cyber attacks, and those school districts have tons of data, a lot more in hospitals though. So I guess what are the potential ramifications of these attacks on hospitals?
Yes, quite severe. So, hospitals can have a lot of costs. You take Common Spirit health care earlier. They are going to be spending about $160 million to get out from this attack that happened to them from a ransomware attack. It affected just 624,000 patients. So it's huge. All the data is now at the hands of these attackers. They can sell it, they can use it for all kinds of bad things. That's why hospitals have to be proactive and take certain action.
So you believe that the issue may be that these hospitals don't have the necessary cybersecurity to protect their patients and to protect all of the data that they store. I guess, is there anything that people need to know about all of these recent cyber attacks?
Yes, so everyone should be on guard. First of all, they need to be taking a hard look at where their healthcare is being provided and ask some questions. What kind of security do you have? They need to be making sure that perhaps the healthcare organization uses what's called multi-factor authentication when they log in to access their records online. If they're not, then that's not a good idea. But the healthcare organizations need to do what I call a cyber drill, which is simulate a ransomware attack. Assume that you're going to get attacked, and let's see how you do. Do a tabletop exercise, do a technical exercise, and see if you can, detect the signals. Can you block the ransomware for infecting everything? Can you get up quickly? All those things have to be practiced. And unfortunately, hospitals aren't doing that. So that's something that they can do really relatively easy and quickly, because it's inevitable that they'll be the next target, unfortunately.
Absolutely. Well, all very great information. And thank you so much for your insight and for your time for joining us tonight.
Thanks for having me.
Absolutely.